So I'm going to give an update on All Ireland Hospice and Specialist Palliative Care providers, those that are research active and research interested. And as Karen mentioned, the whole aim is to improve care for people with palliative care needs, to bring together, so in the room here we have hospice and specialist palliative care providers, we have researchers, policy makers, funders, charities, and we have our public and patient involvement contributors through Voices for Care. We really want you to learn from each other at this session and to share and to understand both the barriers and the enablers, and we'll be doing a session this afternoon on that. And as Karen mentioned, we will be doing a position paper and we will collaborate and consult with you in relation to that before we publish it. So, as Karen mentioned, we developed a survey. We sent it out to our providers, to the providers across the island of Ireland in the area, and we did analysis. And I would like to thank my colleagues in the Institute for supporting that, to Marie Curie Northern Ireland as well when we were developing the survey, and to Dr. Jackie Boylan and my colleague Jane, who were involved in the data analysis. So this really was part of the Palliative Care Research Network strategic plan to get a baseline of what is the current research activity and interest in research within hospice and specialist palliative care providers. 18 organisations completed the survey, and with some organisations having more than one response. And just to say a big, big thank you to all those organisations that took the time to complete the survey. And I know a lot of you are here today, so welcome. So the organisations that participated, we had great representation, 9 in Northern Ireland and 9 from the Republic of Ireland. So we had the Belfast Health and Social Care Trust, Foyle Hospice Derry, Marie Curie Northern Ireland, Northern Health and Social Care Trust, Northern Ireland Hospice, the Southern Area Health and Social Care Trust, the Southern Area Hospice, the South Eastern Health and Social Care Trust, and the Western Health and Social Care Trust. And in the Republic of Ireland, we had Galway Hospice, Laois Hoffley, palliative care provider, Laura Lynn, Ireland's Children's Hospice, Marymount University Hospital and Hospice, Milford Care Centre, Northwest Hospice in Sligo, Our Lady's Hospice and Care Services in Dublin, St Francis Hospice in Dublin, and the South East Palliative Care Centre in Waterford. So it's a really good kind of baseline of what is the current activity and interest. So those that participated and helped us to complete the survey were those in management, as you can see. We also had nursing, allied health professionals, and clinicians. So of those organisations that participated, 12 considered themselves to be research active. So they were either developing and or leading and recruiting participants, or they were involved in studies by recruiting participants. And again, this was a spread between 6 in Northern Ireland and 6 in the Republic of Ireland. So it's really interesting, and you'll see the specialist palliative care providers and the hospices there that are involved in leading, and those that are recruiting participants. We also asked the question about those hospices and specialist palliative care providers, what about your interest, for those that aren't involved? And there was across a number of organisations, 6 organisations, and 5 of those said they are interested in being involved in research. So this is a real opportunity here, and 1 saying that this isn't something they're interested in at the moment. And it may be because of the size of that organisation or their focus and their resourcing. And I suppose today we're really conscious that we lift all boats, those that are research active, to support them to become more active, and also to support those hospices that are interested in getting involved. And how do we do that? We asked the question about research in the strategic business plan for the hospices and specialist palliative care providers, and 59% said it was in the plan, and 22% said this is something they would like to build towards. So you can see it's a real focus from an organisational perspective. We did some research, some questions then around what were the barriers in the organisations to conducting research. And this was very interesting. We based it on some of the work that Professor Catherine Walsh, who's speaking this afternoon, has done in the UK. And I suppose just to let you know, the number one barrier was the lack of protected time and competing priorities. So the resource in perspective. Number two was the access to research support, expertise and infrastructure. Then there was a joint third, understanding how to apply for research funding, understanding what research is and what is needed to conduct research, no formal palliative care training, leadership to support palliative care research, and then two in joint six, the perception of research as not being part of routine care, and the patient and public perception of palliative care. So this was very interesting to get this understanding across the organisations. And then if we look at these ranked against, I suppose, the areas, the first one is a resourcing issue. The second is really around the research knowledge. The third is about the culture of an organisation, looking at the leadership. And the fourth, public and patient perspectives. And I suppose we're going to look at these areas this afternoon and see how we can support the development of research. For those that were research active, this was really interesting just to see, well, what were the barriers? And again, you can see the consistency, resourcing, research knowledge. But one area that came out for those that are developing or leading in research is the organisational culture and a leadership to support palliative care research. So that's very interesting. For those that are kind of heavily involved in research, they're still identifying this as an area to look at. And then for those that are not active, for those interested in being involved, again, it was resourcing and research knowledge came out as the barriers. So a lot to take in there. So we've talked about the barriers, but what about the enablers? What will support? And I suppose just some individual comments on the barriers. One of the things was building strong relationships with universities. We're delighted to have members of our palliative care research network here representing the different universities across the island of Ireland, including the chair and the vice chair, Professor Kevin Brazil and Dr. Geraldine Foley of the PCRN Strategic Scientific Committee. There was a lack of understanding of how research relates to clinical care. Accessing funding was seen as an area, and funding of clinical staff. That senior clinical staff are not given the time and the space to support research. And talking about maybe it's impossible to conduct it if that is not given. So the top ranked enablers for conducting research were, it's no surprises there, the allocation of staff time, dedicated staff, example research nurses or research leads, and funding. Collaboration with universities, charities and policymakers was the second. The third was knowing what other organisations are doing. The research guides, support and training, and Catherine Walsh will be talking a little bit about some of those supports they've developed in the UK that can be accessed by everybody. The supportive clinical lead. And then finally, the fifth one joint was ethics application support and access to public and patient involvement contributions. And we're going to discuss that in the second session today as well. Again, if we rank the enablers and categorise them, we see that resourcing, collaboration and knowledge, leadership, and patient and public engagement are those top-ranked enablers. If we look at the individual comments on the enablers, we try to give protected time for our care staff, but of the competing demands that there are there. The bite-sized education sessions, they're saying, would be very useful, and promotion of master's and PhD programs with supports. Collaborative opportunities, such as those facilitated through meeting platforms by the Institute and by other organisations, and the multidisciplinary team working together on research. So other needs that were identified were opportunities for health and social care professionals and the non-consultant hospital doctors to be involved, because of their rotations and the nature of their work. Looking at publications across all disciplines and their involvement, looking at research in the community setting, and one very telling, we don't know what our needs are. So very honest, open comment there. So then what we did is we looked at those organisations that had said they were either leading or recruiting and their involvement in research. So for those, these are just ongoing projects. It doesn't include those projects that organisations may have been involved in the past. So of those organisations, we had 36 ongoing projects. So it's quite a lot of projects. In the Republic of Ireland, they were in Milford Care Centre, St Francis Hospice, Our Lady's Hospice and Care Services, Marymount University Hospital and Hospice, Laura Lynn Ireland's Children's Hospice, and in Northern Ireland, the Belfast Health and Social Care Trust and Northern Ireland Hospice. And as you always say with the survey, it depends on the data and the participation. So this gives you a good baseline. We're not saying it's totally comprehensive, but this is what we've got at this moment in time. And this was delivered in April and May of this year. So very interesting to know as well about how is the research funded. So 47% of the research, there is no funding. 33% there is some external funding, and you can see the mixture of funders both from the Ireland perspective, UK and the international perspective. And we're delighted, we have some of our funders here today that fund the research. And so it's very interesting that 17% was in-house and funded in-house. The project categories, if we looked at them and we tried to categorise of those 36 projects, we can see that the areas people were most involved in were health services research, followed by projects on cancer, then patient and experience decision support, dementia, neurodegeneration, children's palliative care, frailty, education and clinical management. So there is a little bit of a mix there across the areas, but we do see that it's mainly in the area from a condition-focused perspective on cancer. The participant types and methods, we saw that the participants to the studies, and I know Professor Christina Fall is going to give us some input on, what they found within the UK on the participants. But so the participants types that people were looking at, and these are just the number of projects. There was 12 projects that were recruiting staff, 10 recruiting patients, 6 were data analysis, chart review. We had 5 who were recruiting staff, patients, family carers, the general population. 3 was a review, and 2 were patients and families. So it's quite a mix of participants being recruited, and as you can see, the majority of the studies were observational, 7 interventional, then the systematic reviews and service evaluations. And then one of the things, and this does come up, and we're delighted we have representation here from the HSC who's going to speak to this, and from one of our hospice, St Francis Hospice, talking about what it's like from a local level. And also we're going to show a video from Marie Curie UK around their governance procedures around ethics. So it's really interesting to see that, there's quite a mix of ethical approvals, and it's something for those that are involved in research or starting in research. It always comes around ethics, and can I get ethics, and how will that go, and the time and effort that it takes, and that some people may have to look for 3 approvals across university, hospitals, and their hospice or specialist palliative care provider. So it's quite a mix. You can see the HSC, the HSC R&D were noted, international approvals, some were not required, some within the organisation. And I suppose this is a really important slide too, because the research, to make sure it's done towards the priorities. What are the priorities? And let's research that. But what do you do with the research? I suppose, how is it making an impact? And none of us want it to sit on a shelf and, be an ice-bound product with dust gathering. So we asked the question, what were your outputs or your expected outputs from research? As you can see, publications always has a very large number of people are looking for publications. And we're saying this is a good thing. This allows us to share the knowledge, that it's evidence-based research, that it's peer-reviewed. It is not the only way for research to be shared. A lot of organisations held a dissemination event. One of the areas that was really good as well is that workshop with staff about the research, really trying to understand and unpick that research. Conferences and international conferences, it's very good to share, and guidelines. But other less reported impacts, and these were really, I think, quite innovative, creative, and where we were all trying to get that mix. They were looking at further service development. They're looking at how they can adapt patient information as an output from the research. Looking at improvements in resource allocation based on the research and patient prioritisation, like for an output or an expected outcome. That's really important. There was also a national policy in telehealth that was developed from the research, and the differences in approaching dementia care was from research that was done within these hospice and specialist palliative care organisations. So you can see how important the research they're doing is to make a change, and that I suppose it would be nice to see more of this happen. So in conclusion, I would just like to recap on what we've done, because I know I've done a whistle-stop tour of all those main things. But the main take-home message is that we have 12 organisations across the island of Ireland, hospice and specialist palliative care providers, who are research active, both leading on, delivering research and recruiting. And we have 5 hospices and specialist palliative care providers who are interested or being involved in research. And we are conscious, as we said with that survey, some of those hospices that said they're interested might be doing some research and it mightn't have been noted. So we always take that with a pinch of salt, but we're just saying there is a great number there of interest. 59% have research in the strategic business planning, but 22% would like to include it. So it is an area going forward. It's becoming more important to show evidence-based care. The main barriers to involvement are resourcing, research knowledge, and an organisational culture about the lead, having leads for research. The main enablers are resourcing, collaboration and knowledge, and leadership. Not surprising when we look at the barriers. It's really interesting to see those 36 ongoing projects. As I said, there could be more than that. This is our, baseline at the moment, and we'll be building on it. Across 7 organisations, and very interesting, the 47% of those projects are not funded. 17% are funded in-house and 33% funded externally. Again, we said the projects are focusing on health services research, cancer, patient experience, decision making, and they're recruiting mainly staff and patients. The studies are mainly observational and intervention based, with ethical approvals across a mix of organisations. And as we said, the outputs today are focusing on publications, dissemination events and workshops with staff, which are all good, but there are some examples of real impact happening at an organisation and resourcing level from the research. So really interested for the rest of today that you're going to take some of this information, and in the afternoon we're going to have an open session. We've great representation across a diverse number of organisations here, so it's a real chance to get involved, have your say. We will be consulting on the results from today, and we would really like your involvement. So thank you for your attention, and we'll be doing Q&A after this. So thank you.